All right, I think we might get started, and those that join later will be able to see what they've missed on our YouTube. So, welcome to the Global Nursing Network for Rare Diseases Education webinar. My name's Sian Gannon. I'm one of the founding members of the Global Nursing Network for Rare Diseases. And I am based in Perth, Western Australia, and I work at the Rare Care Centre as the clinical nurse specialist there. I'd like to thank you all for taking the time to join us today. If this is your first webinar, welcome. For those that are returning, nice to see you again. And hello to everyone that is joining us on our YouTube channel. So I just want to let you all know, for those that have just joined, this webinar will be recorded for the entirety because we do pop them up onto our YouTube channel, recognizing that we are a global network. So time zones do have an impact on the availability of some of our members. So you will be able to watch this webinar again on our YouTube channel. And on that, being a global network, we now have the ability to translate our webinars live. So if you would like to use Wordly and view the webinar in your first language or a language that you prefer other than English, you can scan the QR code and change the language to be translated for you. If you have any issues with that, just pop that in the chat because my colleague Jasmine will be monitoring the chats to help you with that as well. So it's a great step in reducing the language barrier for our webinars, and I'm very excited to see how we progress. So if you do use Wordly, we would love to hear your feedback as to how easy it was and whether or not it was useful to you. So as we normally do, I'd like to just take a moment to do a global welcome. As a global network, we respectfully acknowledge the Native, Indigenous and First Nations people on whose ancestral lands we gather around the world, as well as the diverse and vibrant cultures they represent. So a quick little bit of admin, and then we will get right on track with our amazing guest. So we would like to ask if you can pop your microphone on mute just while the presentation is happening. There may be opportunity to ask questions at the end, but if you can, just out of respect for the presenters, if you can leave your microphones on mute, that'll be fabulous. Like I said before, we do encourage you to use your video so we can see your wonderful faces to your name, because we do want to create that community of practice here at the Global Nursing Network for Rare Diseases. Please feel free to utilize the chat function to ask any questions we can circle back to. And if we don't get time, we will also be able to populate the answers for the YouTube channel as well. Discussion is encouraged, questions are encouraged. This is a safe space. We're all professionals here looking to learn. So please feel free to pop your questions in the chat. Now, I will stop sharing and I will pass over to our presenter for today's webinar, Katja Ekholm from Sweden. I will just click off of that. And we'll hand over to you, Katja. Thank you so much for your time, and I'll be here if you need me.
Hey, okay. Now see what I do here. I'll stop this once again and just see if I can get back to where I should start. And let me see. Here we go. And then see, share. Do you see my slide?
I can see all of the slides in PowerPoint.
Good. All right, then I can also see that unfortunately my internet connection is going down a bit, so I'll hope to be able to present all of this. Can you see my first slide?
Yes, that's beautiful.
Good. Hello, everyone. I'll just pop you down as well. Here we go. Okay. In Sweden, I'd say good morning at this time. But since we are scattered everywhere around the world, I'll also say good day and good evening. And maybe some of you it's good evening for you. I'm so happy to be here. I'm so happy to be a part of the Global Nursing Network Rare Diseases. Oops, let me see. Now I'm a bit down. Okay. Now, first of all, I'd like you to imagine your child is born with an unknown disease. A mystery that no doctor can solve. For many families, this means a long and stressful journey filled with uncertainty and worry. Even after years of testing, answers are often missing. So, what if we could find a way to help more undiagnosed rare patients to get a diagnosis? Today, we are going to talk about why working together, both in our own countries and worldwide, is important for solving rare and undiagnosed diseases. We will look at global efforts to help people with rare diseases and Sweden's multidisciplinary approach through the Undiagnosed Disease Network. We will see how teamwork is helping more patients get diagnosed, and we will also talk about the important role of nurses and healthcare teams in patient care and precision medicine. My name is Katja Ekholm, and I work in Stockholm, which is the capital of Sweden, at a university hospital called Karolinska. So what is UDN Sweden? At Karolinska Institutet, where I work here in Stockholm, together with Genomic Medicine Sweden, and Wilhelm Foundation, we have started a national Swedish initiative called the Undiagnosed Diseases Network Sweden. Our goal is to find answers where today's methods are not enough, and we do that by combining advanced genetic techniques with expert knowledge from different fields. And we focus on diagnosing and understanding rare diseases that cause intellectual disabilities and developmental delays. And experts from all university hospitals in Sweden participate in Sweden. And these are the red dots where we could see the university hospitals. Here. So we have participants from all over Sweden, but the coordinating team is here in Stockholm with me and consists of Ann Nordgren, who is a professor of clinical genetics and our PI in the Rare Diseases Research Group. And she's also a senior consultant at the genetics department of the hospital. And then we have Angelica Delgado Vega, who is a physician and a researcher, and she has a PhD in medical science, and she's also working at our clinical genetics department. And then we have Fulia Thailand, who is an associate professor or a docent. I don't know if you say that in English, but it's a docent in Sweden in medical genetics. And she's a research specialist. And then it's me. I'm there smiling in the middle. My name is Katja Ekholm, and I have a background as a registered nurse. I'm also a midwife and a genetic counselor. And nowadays, I'm also a PhD student, and I'm focusing on psychosocial aspects of genetic testing and the meaning of a diagnosis. And then we have Eva Ekblom, and she's our solid rock in the group. She's handling like everything, including the administration. And last but not least, Britt-Marie Anderlid, who is a pediatric neurologist, associate professor or docent, and researcher, and also working at the clinical genetics department. And of course, we are in close collaboration with networks and organizations all over the world, like here you see UDN, Undiagnosed Diseases International, and the European Reference Network, Ithaca, and Wilhelm Foundation. Okay, so there are hundreds of millions of people globally who live with rare diseases, many also living with undiagnosed conditions. And this is causing a significant public health challenge. There are more than 8,000 known rare diseases affecting around 5% of the global population. So we have 72 to 80% believed to be genetic. We have few experts. They are scattered all around the world, and research is fragmented. And for the vast majority of the diseases, there are few or no treatments available. So diagnosis and treatment of rare diseases demands collaboration and joint efforts. And even though Sweden has a healthcare system of high quality, it is fragmentized. Okay, all of us working in healthcare, we frequently see patients with undiagnosed conditions. And this slide shows that 60% remain undiagnosed after whole genome sequencing analysis. On the slide, we also see a clip. It's another video. It's from the National Swedish News. And this one, I won't show this one because it's in Swedish. And we will get back to this boy later. But we can read a quote from his mom. The quote is here. For us, it would mean a lot to understand Ludwig better, to be able to medicate him correctly. The UDN Sweden project has a special focus on children with neurodevelopmental disorders who remain undiagnosed despite extensive genetic testing. Through UDN Sweden, these patients can have access to the latest genomic technologies and research, which can lead to diagnosis and improved patient care. But there is a challenge, and that's that there are long diagnostic odysseys, that delay proper care. So here we can see it's an infographic that was made by GNNRD, and this is, you can find this in many different languages. They have translated it, and if you want to look into it more, you can see, I can't see my arrow here. You can find it through this link here, or you can just Google GNNRD's infographic. But it shows us the patient journey through diagnosis. And you can see from the first symptoms here, and then you go round and round in the different systems, trying to find out what you have. And the diagnostic odyssey can span decades, leading to significant emotional, financial, and social burdens. But how then, if a diagnosis is found? I said, we know that there are the vast majority of the rare diseases, there is no cure for them. So why does a diagnosis matter to us? If there is no cure, why should we bother trying to find out what diagnosis it is? Well, we believe that precision medicine starts with precision diagnostics. A genetic diagnosis may result in better care and deeper understanding of what symptoms to expect. We can maybe have targeted therapy for some of the diagnoses. We can maybe offer better surveillance, and knowledge about recurrence risk is important. Access to prenatal diagnosis may be there for some. very importantly, it can answer, give answer to the question why. Why has this happened? Which is very important for many families to find out, and other ones too as well. But the important answer why. It also allows patients to join patient groups. All right, the human genome consists of 3 billion base pairs. And within this huge amount of genetic information, each person has more than 5 million genetic variants. And because there are so many variants and only some of them causes disease, finding the one specific mutation that causes a disease is extremely challenging. Therefore, we often do whole genome sequencing with a trio here, which means that we sequence the child's DNA along with both parents. So there is a child and 2 parents, which gives us a trio. And then we use the parents' genetic data as a reference to help identify the cause of a disease. So by combining the child's DNA with the parents, experts can filter out common inherited variants and focus on the specific types of mutations. However, a result can be reported as normal, which means that no disease-causing findings were made. But this doesn't have to mean that the patient's condition hasn't a genetic cause. So there are 250 to 300 new genes described every year. So we get more and more knowledge every year. And what we can do is that we can save the whole genome sequencing data and reanalyze it in a couple of years when we maybe know more. So why do 60% remain undiagnosed then? Why can't we find the cause? There are many reasons for that. Like I said before, there are still thousands of disease-causing genes to be discovered. We need to learn more. There can be technology limitations. Some DNA changes are too small or in tricky places for current technology to find. There can be complex mechanisms. Sometimes it's just not one gene, but many genes and the environment working together that is disease-causing. There can also be data issues. Some groups of people don't have enough data in research, which makes it harder to find answers. And we can have clinical challenges, like overlapping phenotypes in the patients, which means that different conditions can look alike, and that makes it hard to figure out the right diagnosis. We also struggle with incomplete referrals and lack of access to genetic testing, of course. Infrastructural and financial limitations can be a cause. Okay, we are convinced that an organized approach is essential to improve outcomes. Undiagnosed rare disease patients should be recognized as a distinct population with specific unmet needs by national authorities. We think it's important to develop national sustainable programs for undiagnosed diseases, to promote ethical international data sharing to advance research and diagnostics, and very importantly, to empower patient involvement in governance and program design. Here we have a slide that shows us what has happened in the past 60 years. Because looking back, here you can see the arrow. Looking back, there was a time when the term mental retardation was used without any deeper understanding. We had families who got no answers, no treatments, and just questions. But then something happened here in 1959. Down syndrome was discovered. And look, after this, look where we stand today. Through decades of research, collaboration, and innovation, we have moved from broad clinical descriptions like mental retardation to identifying over 1,000 intellectual disability associated genes. Each of these discoveries is more than just a name in a scientific paper. It represents real hope for individuals and families. From recognizing just structural aberrations in chromosomes to pinpointing monogenic disorders and even identifying 116 treatable targets. So collaboration and science is turning knowledge into action. Okay, here we go. I'll try to explain this. It's the NIH Undiagnosed Disease Program started in 2008. It started to help patients who had waited years for answers. And in 2013, okay, here, the program expanded in the United States to National Network, UDN. But even with these efforts, many people around the world still didn't get a diagnosis. So to change this, the NIH and the Wilhelm Foundation here, they hosted international meetings in 2014 and 15 and brought together experts from many countries. And this led to the creation of UDNI, Undiagnosed Diseases International. And that was created to help patients and families with unknown conditions by sharing knowledge and improving testing methods. A very important partner in this effort is the Wilhelm Foundation, which is a global organization supporting people with undiagnosed diseases. And this Wilhelm Foundation was founded in Sweden by two parents, Mik and Helene Cederroth. You saw that in the video in the beginning. Mik and Helene lost 3 of their children to an unknown disease. So their mission is to improve diagnostics for rare diseases so that other families don't have to go through the same pain. So, and together with NIH, Undiagnosed Diseases Program, they then co-founded the UDNI. And UDNI now connects specialists worldwide to improve care, rare disease diagnosis. And in UDN Sweden, we are really happy to be part of this network. It's fantastic. So these are big steps that I just wanted to tell you about. And otherwise, we think that big steps in precision medicine is when governments and healthcare organizations are putting money into genetic and molecular testing to help patients get better care. And like here in Sweden, our government set aside 12.5 million Swedish crowns to genetic and molecular diagnostics, and then also 49 million Swedish crowns for precision medicine and cancer testing. And the goal here is to bring genetic research into real-world healthcare, and especially to help children with rare diseases. So with this investment from our government, we have now started organizing a multidisciplinary collaboration across Sweden. So we get together research engineers and patient organizations and Wilhelm Foundation, clinical geneticists and genetic counselor, molecular biology. You see the list. We believe in having multidisciplinary collaboration. And the work is, of course, done in collaboration with international networks. And we discuss patients in these contexts with informed consent from the patients, of course. And And again, we work closely together with the European Reference Network, Ithaca, and UDNI. I also want to tell you about the UDNI diagnostic working group, which has monthly meetings where unsolved patient cases are discussed. And in this group, which is co-chaired by Ann Nordgren, you saw her in the picture before, she's also in our group from Sweden. We also have Lorenzo Botto from Utah and Emma Palmer from Australia, and Fulia Thailand from Sweden, who is supporting this group and organizing it. And this group is growing all the time. We have clinicians and researchers from different UDPs. As you see, there are many UDPs all around the world. So collaboration. Okay, why is then UDN Sweden needed? Why do we work in UDN Sweden? We work to provide answers for patients and families. We want to evaluate new technologies, new analyzing methods. We want better tools to evaluate genetic data. We want to optimize the diagnostic pathways. We want better phenotyping tools, trying to figure out the different ways that we look and the phenotyping tools. We want to improve care and diagnostic processes for patients and families. We want to create knowledge and know-how and advance medical research in rare undiagnosed diseases. So this is why we need UDN Sweden. All right. So in 2023, we started to include children with undiagnosed intellectual disabilities with or without congenital malformations who had been analyzed with different methods before. They were included now in this. The families were consented for participation and global collaboration. And the first 79 patients were included in 2023, and these were families that were also involved in the Wilhelm Foundation. And then in 2024, we added 100 more children from all over Sweden's different university hospital regions. So all different parts of Sweden are in this project. And what we did was that we sent out information to the families and informed consent here. And we collected blood samples. We wanted to do analysis with a combination of new sequencing methods. So we needed more blood samples from them. We sent out questionnaires to collect psychosocial data, and we started to organize clinical data in a tool that we named Tip to Toe. This is a tool that we are developing here, and we wanted to call it Tip to Toe because it's from the head and down to the toes of the patient. So what is Tip to Toe? Since medical information about a patient often is spread across multiple healthcare units, it's very sometimes, or very often, I think, it's very, very difficult to get a good overview over the patient. So together with Wilhelm Foundation, we are developing this deep phenotyping tool called Tip to Toe. And in this system, all clinical data can be collected in a structured way and also include photos and x-rays and everything. So here we go. Now this is how it looks. What we do is that when we have a patient, we collect everything. We call around Sweden or even other countries if the patient has been anywhere else, and then we gather it everything up in this tip-to-toe system. So it ends up looking like this at first when we have collected all data. And then in the end, when all clinical data is documented in tip-to-toe, this program sums up the patient-specific HPO, Human Phenotype Ontology terms. And these HPO terms are standardized terms that are used to describe the phenotype of a patient. So it's HPO terms are used all around the world. And in the end, this information is merged into a specific tool called Scout, which is used for the genetic analysis. So a whole lot of information is put into in an organized way to help us to analyze data better. And in UDN Sweden, we also want to improve the care and diagnostic process for patients and their families. So some of my PhD projects are included in the workflow, which means that we send out questionnaires to find out what the parents think about the diagnostic process, what experiences they have, and if they think it is important to have a genetic diagnosis. And yeah, as you see, we have questions like how emotionally difficult has the diagnostic process been so far, and how important would it be to get a diagnosis, and so on. So until today, I have I have 204 parents that have responded until today, and it's our baseline questionnaires, which was sent out at the time when the blood samples were collected, but before we had any test results. And now we are currently analyzing the responses that we have received from the questionnaires, and I will invite some of the parents to participate in a semi-structured, in-depth interview to gain deeper understanding of the parents' experiences. And there's also a follow-up questionnaire which is going to be sent out when the analysis have been finalized. And also in this, I want to mention that the questionnaires were created in collaboration with researchers from many other countries and patient representatives. Let me see. Oh, I think I will. This slide is just showing that we are also doing a national effort to create a national genomics platform. And then I also had this slide, which is we have this national variant rounds where we discuss the analyzing is discussed nationally so that we can learn from each other, so collaboration in this part too. And this is how far we have gotten in Sweden now. We have recruited the patients, we have done the sample collection, and the sequencing part is being done here. And we are now interpreting the results, or we, the experts in this field, are interpreting the results. And we are about to come to this step when it's time to report back to the patients and the doctors and set up recommendations for follow-up. So this is what we have done in Sweden so far. But now let's go back to the global collaboration. Here we have an article that you can read if you want to. I hope you want to, but it's an article that we wrote about the first undiagnosed hackathon, which we had here in Stockholm together with Wilhelm Foundation and Phenotyps. We held it in June 2023 at Karolinska. So what is a hackathon then, you might think? A hackathon is an event in which participants engage in intensive collaboration, problem solving over a very short period. So the idea came up when that we were sitting together in a group in a meeting, and with different people from all around the world, and we were thinking that what if we could try to find a new way to tackle these tricky unsolved patient cases that we all struggle with. So we decided that, we should invite experts and try to do this in a concentrated way. So, well, in the end, we invited nearly 100 experts from 28 different countries all over the world to work together for 48 hours during a weekend here in Stockholm to find answers to patients with rare diseases that doctors couldn't solve before. And the patients, we found 10 undiagnosed families. The patients were nominated by local UDPs. As you saw, there were these UDPs all around the world. So the patients were nominated by the local UDPs and then reviewed by the UDN diagnostic network. The working group that I mentioned before, they were talked through in this meeting and evaluated. And then, of course, the patients had given them their consent to do this. Okay, so we found 10 undiagnosed families who we started to work with. And there were a whole lot of analysis made, and we have had these experts here for the weekend. They worked very, very intensively with this multidisciplinary approach. And we then, in the end, found that by combining these different skills and technologies, we could improve the way rare diseases are identified. And the event showed that teamwork and new ideas can help solve medical mysteries faster. And the hackathon ended up by providing a diagnosis for 40% of the previously undiagnosed families. And I will now present one of them so that you get an idea of how it looks like. This is Ludwig. He is a 6-year-old boy. It's the boy whose mother's quote we read in the beginning of this presentation. He is the second child of a non-consanguineous healthy parents from Sweden. He has a healthy older sister, and the family history is unremarkable, except for mild intellectual disability in a father's cousin. Ultrasound examination during the first trimester of pregnancy showed increased nuchal translucency, but then a combined test did not show a high risk of trisomy. So the parents were counseled and went ahead with the pregnancy, and the pregnancy went smoothly. He was born after 41 weeks. He had a little bit of a struggle there during the birth, and he got a low APGAR 357. He had perinatal asphyxia. He required ventilation at birth. He got neonatal seizures, and since birth, he has, as you see, a lot of different symptoms. He has severe motor developmental delay. He can't sit without support. He has intellectual disability. He has malformations and epilepsy. He has a lot to struggle with. So a massive amount of different investigations have been done, and here you see some different analysis. But I want to mention that his mum suspected something called TBCK syndrome, because she had seen another Wilhelm Foundation child. I think it was on Instagram or something, but she had seen this other child and she said that it could be this. Okay, so anyway, we worked on this as with the other children that were worked on during this hackathon. We tried to make the diagnostic process easier and gathered all information in this tip-to-toe tool. And a combination of different sequencing methods were used to get this complete picture of genome and transcriptome. You see here are different methods called short read sequencing and long read sequencing and RNA sequencing. And each of these methods has its own strengths and weaknesses. So a combination of them makes the results more complete. And the hackathon experts, they worked during the weekend. There was intensive work, I can say. And in the end, a compound heterozygous variant was found in the TBCK gene. So this boy has 2 different mutations in the TBCK gene, one from each parent, which causes his neurodevelopmental disorder. It affects movement and thinking abilities. It's a genetic condition that can lead to serious brain and nerve problems, and treatment focuses on helping with symptoms. But he could start with this treatment. And now when the boy has a diagnosis, his family got the answer why, which is a big relief for them. And they can also connect to this TBCK Foundation and get to know other families. So it was really important for them. Now, before I click to my last slide, I would like to show you a short video also. But before that, I think we should take a moment and reflect on the role of nurses in rare disease care. Nurses are essential in identifying, supporting, and guiding patients through their diagnostic journey. And by staying informed and proactive, we can improve patient experiences and contribute to the success of precision medicine and best practice. I think this is important. Now I realize that I have something more that I want to tell you before I show the video. I don't know if you have seen that this Rick Guidotti name is underneath almost every picture here in the presentation. And if you haven't heard of Rick Guidotti before, I think you should just look him up. He's in this positive exposure Rick Guidotti. You can Google that. He's a fantastic photographer in New York, taking pictures of people living with rare diseases. And he has this beautiful way of saying that change how you see how you change. So let's move on to the video. Now I say thank you for listening, and I encourage those who haven't joined the Global Nursing Network Rare Diseases to do so, because we need to collaborate. Thank you.
Thank you so much for that presentation, Katja. That is amazing. There's virtual claps all around the room, which is amazing. I loved the videos, number one, that was beautiful. And also all of the work that you guys have done in terms of undiagnosed diseases, because as well as rare diseases, we do focus on the arm of undiagnosed diseases as well. And I think that's really important to highlight with all the work that you're doing. And the photos, the quote that the photographer uses was beautiful. Can you just say it one more time for the group?
It's change how you see how you change.
Yeah, I just think that's beautiful. What a gorgeous way to end the presentation. Thank you. I'd just like to open up the floor before we sign off to see if anyone in the room had any questions or comments that they would like to ask or share with Katja before we sign off for today. We've got a few minutes left, so I want to give everyone the opportunity to ask away. Please feel free to unmute as well, or pop it in the chat if you'd prefer.
Yeah, and I often sit during when it comes to this point, I often sit and I have this question, but maybe I won't speak out loud and da, da, da. So if there are any questions and you want to reach out afterwards, then please do so. I'd be happy.
Amazing. And you can also find Katja on the network as well. For those that are already a part, you can send her a message there. Aslin's popped it. Yeah, thank you, Aslin. Well, I think everyone's absorbing all of the information that you've shared with us today, Katja. And I think the hackathon, I know a few people that attended, and I know how intense the weekend is, but how emotive and euphoric the collaboration creates. I know that the team that have been there were very empowered on their return to help continue that search for diagnoses after the fact. And it just highlights the importance of that collaboration. We've got a couple
fantastic is that it's moved on. The first one was here in Stockholm, but then it's moved on to other cities, and it's going to be something that we keep on doing in different countries. And that's beautiful, I think. And yeah.
We've got a question in the chat from Elizabeth. Thank you so much. What are the criteria for a patient to be considered for UDNI?
There are. It's always. It's just to reach out to the UDNI, to the diagnostic network group too. If you have a patient, you can always contact them and ask if this is something that could be discussed. But you should have. I mean, it's not just patients who they have gone through a lot before they come there too. So, but please contact. You can go back in the slides and see you have Ann Nordgren and Folia and Emma and the others there.
Yes, they're more than willing to assist, and you've obviously got the criteria for a rare disease in terms of multi-system, odd lab results. Those are your rare disease criteria, and it's the inability to find the diagnosis from that would be when you're thinking that the patient would have an undiagnosed disease, because more likely than not, it will be a rare disease.
I'm sorry, I might ask it maybe, can you hear me?
Yes,
Yes.
absolutely, please.
Yeah, are the patients the ones who contact this network, or are the doctors the ones who say the situation and consider the patient for the network?
It's the doctors are contacting, so it's yeah. But then now I'm trying to recall. There are patients also that are contacting the UDN network, but I would say that go through via the doctors would be the best.
Thank you for clarifying your question there, Elisabetta. All right, just a lot of praise in the chat, Katja. Lots of praise. Fabulous. I'll just wait for a couple more people. I can see that they're furiously typing. Like we said before, if you have a question after today, or if you're watching the YouTube and you have a question, you can join the network and ask Katja. You can find her and direct message her on there, or start a discussion on one of the boards. In saying that, I will just like to go through to our closing slide. Clearly, my internet is also struggling today. So for all of you here today, I hope that you are already members. If you're not, please use the QR code on your screens now to join us. The Global Nursing Network for Rare Diseases is all about creating that community of practice. We've been up and running since March of 2023, and we are steadily growing, toot sweet, as they say. And the lovely Jasmine, who joins me today, is now leading the charge for the Global Nursing Network and is going to grow it even further over the next few years. We want to create this community of practice. We know that nurses are important within rare disease and undiagnosed diseases patient care. We are the largest workforce in health, and we have a unique opportunity to connect our patients with the medical field and to support them through their whole of life experience within the health system. So I would implore you to join if you haven't. Please get your colleagues to join as well. We obviously run these webinars. If you're part of the Global Nursing Network, you do get access to these directly, and you can join us live rather than watching them on YouTube. There is education opportunities, professional development opportunities, and again, that community of practice from nurses across the globe. So I will bid you all adieu. I hope you enjoy the rest of your days wherever in the world you are. And we look forward to seeing you at the next one.